Let's just look at a common criticism, which is that you ain't a scientist, you're not a doctor. What do you know? Why do you think that you are allowed to express a view? What gives you the right to challenge the science and to challenge the medics? Have you noticed how people like to use these expressions, these phrases, as a way of shutting you up? They're like kind of labels that preclude any sensible, rational argument. You're not a scientist. I'm not listening to what you have to say.
As the result of my investigations into Dr. Ferguson's report, I was left wondering whether the claims that the UK was following the science was true. As I settled into the Haymarket, as only one of a small handful of guests, I decided to investigate the science further, but from a Swedish point of view. What was happening in Sweden, and who was in charge?
Actually, I think he looks a little bit like an older and less handsome version of me. What do you think?
Anders Tegnell in Stockholm, welcome to HARDtalk.
Thank you.
Let's begin with the latest picture in Sweden. Your death figures every day from COVID-19, they go up, they go down. It's not the brutal truth that you have had many more deaths in Sweden than you would have had if, like your Scandinavian neighbours, you had imposed an early and very strict lockdown policy. You probably would not have had that catastrophic spread of COVID-19 through your care homes, particularly around Stockholm, if you had run a more strict, a less open policy for the general population.
Yeah, I mean, these people meet a lot of people, even if you have a lockdown. So you can't isolate them. So in that way, a lockdown would not have stopped the spread into them. And we can see now when we are starting to look at these places, we see a decline in the incidence in those places once we start really focusing and getting them to focus on basic hygiene procedures and so on.
At least in contrast with Dr. Ferguson, Dr. Tegnell did seem to be prepared to tackle robust interviews and difficult questions.
Can you regard a situation in which your country has getting on for 30,000 infections of COVID-19 in the population, has a death toll which is significantly higher than your neighbours, standing at around 3,500. Can you regard that as success, or do you have to acknowledge that in some ways your strategy failed?
Yeah, no, that's true. When it comes to the death toll, this didn't work out the way we hoped it. On the other hand, I mean, the connection between our basic strategy in slowing down the spread, if that really in the long run will affect the total death toll in a society or not, that is not clear yet. I mean, we know that our neighboring countries by now have around 1% of the population who had some kind of immunity has had the disease. The investigations we have had in Sweden so far, we have a major one going on to give us a better answer, points to that we have at least 10, maybe 20 times higher level of immunity in the population, which means that we are much further into the spread than our other countries. And if that would mean that the other countries will reach similar death tolls to us or not, I think that's very difficult to judge.
That is a very interesting answer.
The lead Swedish epidemiologist was also prepared to front up and admit where he had made mistakes. This appeared to be scientific, in order that we all might learn for the future. Rather than blowing up a smokescreen of R rates or infection rates or taking us all down a hole of mathematical confusion, Dr. Tegnell talked about the science in a way that a normal person could understand. But behind the heroes and villains of the press pantomime, was there something more fundamental at work, as I had been led to believe by many of the interviewees who had talked about important constitutional changes in the 16th century? I needed to find a professor of history and civil society.
The agenda here from the beginning was to make sure that the healthcare system didn't collapse. It was also to keep the schools open, because for children, for women, this is extremely important. Yeah. And then to protect the elderly. And you can say now, so far, we can say that Sweden was successful in terms of keeping their healthcare system running relatively well. The school opening was probably a smart decision, and that's not linked to any adverse effects. But we have failed when it came to the elderly in a way similar to Britain, actually, right? Yeah, and it's really is a link to Axel Oxenstierna, who is kind of the founding father, right, of Swedish public service, and the idea being here is that you if you're going to fight like Sweden did, right, a very small country. In a lonely part of Northern Europe, right? If you're going to fight a European war, remember, right? This is a really Sweden's moment, right? In Europe, fighting for Protestantism, right? Carrying out battles, right? Throughout, Northern Europe, really, in Russia and Baltic states and what is today Germany and so forth and so on. You needed to have an extremely efficient organization of society at large. And you had no space here, right, for things like corruption, nepotism, and so forth. You needed to make sure, right, the decisions were made on a rational basis, that they created a sense of trust and confidence, that they relied on people being able to make decisions on their own, not sit around waiting, right, for somebody to tell them what to do. And this we see today in the same Swedish corporate culture, which is a much more flat structure than what you are seeing, for example, in a country like the United States, which is a much more of a kind of an army-like structure, where people sitting around waiting for orders from above, right? In the Swedish corporate culture, you are more likely to see that people are willing, right, to make their own decisions, take initiatives. And when people do that, you have a much more creative and more efficient kind of structure where people are not afraid of authorities, right? But are willing to work, up and down, and also both vertically and horizontally within an organization. Yeah. And so these ideas are put to place early on during this period, and they sort of become, in a way, standardized and are still relevant.
It appeared that the health experts were largely independent of government in a unique way when compared with other European nations.
The principle, right, of individual responsibility needs to be there as well. You cannot just simply have the heavy-handed hand of the state. If you're going to have a sustainable approach to the pandemic, you need to have participation from all of the citizens, right? And by and large, that's what we have seen in Sweden. I mean, there's a lot of talk now about the mortality rate among the elderly homes in Sweden. That's fine, we should have that debate, but let's not forget, right? The Imperial College predictions, would have suggested that we would have had not 5,000 dead, but more like 80,000 dead in Sweden by now, right? So the fact is, of course, many things have been working in Sweden with respect to this kind of idea that we have to have voluntary participation by the citizens, right? We cannot rely on draconian measures, threats of fines, imprisoning people. We have to also respect individual freedom, because without individual freedom, none of these policies will be sustainable. And of course, we won't have a very nice society if we're going to rely on locking people up.
There were many countries, such as Hungary, Turkey or Spain, to which the professor had referred to in his Guardian article, where it seemed that this top-down government meant that rulers were telling their people what to do. It almost seemed as if some leaders felt that, for good or ill, the people could not be trusted and had to be controlled. They were then told, of course, that their government was following the science. Was there any forecasting done by Dr. Anders Tegnell and his team at that point in time in terms of the likely deaths?
Right. Yeah. No. I mean, I think that the Imperial College predictions, right? Did not land with the same sort of thud here as in the UK, of course, right? And there were people here in Sweden, right? Some people in the scholarly community that were equally impressed, right, with Imperial College as people were in the UK. But I think here, as a Tegnell and his group and others, working on these questions from the scientific community, were a little bit more hesitant to come with very definite numbers of the sort, right? And we should also remember something else here is that the Swedish Health Agency does not have just simply a mandate to care about the epidemic, but about health in a broader sense, right?
Really?
So so that means that this had to be balanced. Whatever decisions you made about the pandemic had to be balanced. For example, questions concerning the health of children, right? So the closing of the school was never even up on the table in Sweden, right? Because this was clear that in a country, and here Sweden and the UK differ quite radically, right? If you look at the OECD data on child well-being, you see that the UK and the US are dead last and have been for quite a long time. Whereas in Sweden, of course, children's rights, children's well-being is very, very high on the agenda, right? Could even say child is king in Sweden, okay? So that meant that, when you were thinking about, okay, what are the different things we have to take into account? It was not as if some people suggest that it was just a question about health versus economy. I mean, economy was important, but it was also the health related to the pandemic and the health and well-being of children, right? So the idea was we cannot just go in here with some sort of a draconian solution, closing down the whole society, right? We have to be much more targeted, right, in what we do. So the idea was that what we need to do is to keep schools open, because there was no indication then, and no indications now, by the way, that primary and preschool was the problem, right? You close the gymnasium, which is the schools for the older students, those who are 17, 18, 19, like high school in the US terminology, and the universities went to distance learning. So you had a more calibrated approach, right, that tried to weigh in, right, several important imperatives, okay? So the focus was not in the same way exclusively on what I call the Champions League of mortality counts, which has become the dominant measure right now throughout the world. Whereas I think here people are a little bit more concerned about, we have to measure other things. I mean, we're seeing now in Norwegian studies showing the enormous cost of closing schools, right, to children. My point here is that, what I would say would be a good thing in Sweden, which other countries could learn from a little bit, is that you have to worry not only about the dead, but the living also, right? We have to worry about the children, the youth. We have to worry about freedom. These are also important values, right? We cannot let everything else fall to the wayside, in a kind of a rush, right, to do everything to minimize the mortality rates by those who are 75, 85 and older, right? Even though we respect, of course, them, and we do want to do as well as we can, right? That's not the only factor.
UK, perhaps, I don't know whether you are able to help me with this. It's like the epidemiologist presents his figure, presents his report, and then says, right, government, it's your problem, the health minister can look after the school issue. Yeah. Would that be a fair distinction to make?
Yeah, I think so. I think so, because, part of the reasoning here of Tegnell and his group was that they did not want to induce a panic mode, right, in the population, right? So to bandy about and throw around numbers that were uncertain at best, right? Yeah. Widely misleading at worst. It was not a particularly good idea, right? We're talking about
the mobility was with him Whereas it wasn't with Dr. Ferguson, so he didn't feel the weight of that problem.
No,
is that right?
He didn't, and I mean, with him, of course, it's particularly shocking since he felt free to give advice to other people that didn't follow himself. So there is something slightly scandalous, even frivolous, about his behavior, both as a scientist and as an individual, in relationship to the very policies that he seems to have been proposing.
I really could not see that there had been much balancing in the UK, certainly in terms of weighing up the impact of children and the broader health issues here. The professor was right that the UK were right at the bottom of the table produced by the OECD. Was it really scientific to close the whole of society down when, as the professor pointed out, the schools and children had not been the issue? He also stated to me that even without COVID-19, the average life expectancy of people when moved into care homes was barely 3 months. It was outside the Haymarket that I stumbled on another issue that had arisen as the result of the crisis: the danger that politicians might exploit it for their own nefarious ends. Because this hotel is usually very busy, isn't it?
No, this hotel didn't, not so much, just a little outside.
But last year,
Yeah, last year.
you must have been loads of people.
Yeah, of course.
Yeah. So, but you have a smile on your face, you
Of
seem happy.
course, because I
Yeah.
am happy. I am happy with
Yeah. I mean, so what?
Everything.
Life goes on, doesn't it?
Yeah, man.
So, what's Morocco like at the moment? Is it got coronavirus problems, or is it okay?
In Morocco, the benefited this situation for take people to jail.
Yeah.
Yeah, because
Jail?
Yeah, it's because the country is not democracy.
But people are sent to jail in Morocco for doing what?
Because so lot of people who was been before active in politics, now it's taking.
So they're kind of using politics to arrest people for coronavirus, breaking the coronavirus law.
Coronavirus just a cause.
Ah, an excuse.
Yeah.
Really?
Yeah.
Do you have any family or friends who've been affected?
It's a long time. I leave Morocco. I can't.
It's a long time, yeah.
It's catastrophic.
Really? And this has made it worse. It was bad already, and now it's really bad. Is that what you're saying? Yeah. It's quite tricky over there at the moment. Apparently, according to him, the politicians are using the coronavirus to arrest their political opponents and throw them in jail. He said it's a dreadful situation over there. You do wonder to what extent this is an opportunity, kind of a cloak to conceal the nefarious activities of the politicians, certainly in North Africa. Perhaps it's not an issue in Northern Europe, but it's just worth sounding a kind of a cautionary note. Last week, I think on the 27th of April, and I need to check this and put my lawyer's hat on and do the research, but I think that a bill has been proposed to Parliament that will require people to take vaccines, make it mandatory. Well, perhaps it's a spooky story, but I will have to drill into it, I think. I did not find the bill, but I found this clipping from before the crisis started. The UK's very own health minister, it seemed, supported compulsory vaccinations. Do you know anybody who's died from the coronavirus?
Yeah.
Yes?
Yes.
Oh, I'm sorry to hear that. What, a friend or family or?
Yeah, I have family.
But have they caught have they got the virus? No.
No.
No. Do you know anybody who has caught the virus?
Yeah, I come out normal, go in, out, sick,
Yeah.
no problem.
So you don't think it's very serious? Yeah. I went down to the river to do an interview with a barista who was studying global health at university, but another spot of rain had driven him off early. Instead, I began to idly wonder about boats and travel plans. Now this is what I need to get me across to Blighty, to get me back to the UK, a boat, or indeed to get me to Poland, because I don't much fancy going back to Poland and being quarantined for 14 days. Apparently it's quite strict. They come round, the police come round and they check up on you. So, COVID-19, exponential growth, mortality rate 18.6, 79% exponential times 15 compounded, magnify for statistics across the whole of the world, infection rate 0.8%, distribution rate, communication rate 7%, death times well, mortality rate 18 months a year, 2 years, comparable 367 in the US, ratio 51%, Dr. Fauci, the Imperial College, I don't see a problem. I don't care if he's got COVID-19. He's my brother. But when I got back, I lucked out with a spontaneous interview of pure serendipity with a girl in a tea shop waiting for her train.
People started getting a bit weird about it, and I was thinking to myself, what am I missing? What is the point of all of this? Why is this not an ordinary flu? What makes this one so much different that we have to close down all our lives? I'm not very well.
Did you feel a bit of an outsider, ostracised?
Yeah, I guess. And sure, I like a good conspiracy, but I don't know if it really felt like I was missing something, like someone who decided something knows something that I don't know.
Oh, so you felt a bit left out?
Yeah,
like,
do you get what I mean?
Like a running joke that no one's let you in on?
Yeah, the government perhaps knew something that I didn't know, like why are they taking all these decisions? Well, my life hasn't changed very much. I've been doing the same thing. I didn't know my life, my way of living life was called social distancing or quarantine, but obviously it does.
Was there not a point at which did you not then go and check things out on the news or read a newspaper?
Oh yeah, I have.
And why
it feels like they just report on the same things all the time. Now I know it's a thing. I don't know exactly what the thing is or like what the hype is about. But
did you not see pictures of hospitals in Italy and coffins and so on and all that sort of thing?
No, I haven't seen that. I've only read like news in Sweden and like mainly local news from Jönköping.
What was the news at the height of the crisis? What was the news about? What were the papers saying?
Oh, I guess like a few more deaths. I remember the first death in Jönköping, and I remember when they reported on the first outbreak in Jönköping as well.
Were you not scared about the numbers of dead people in the world? Did you not see the worldometer?
Do you want to know a secret? I'm not sure that you can put this in your documentary.
Sounds like the best bit.
I really hope no one I know will watch this. But like, I like people, but at a distance. But to be honest, perhaps this is the world saying, no thank you. There's more than enough of you and you're ruining my living space. I'm not sure, because we live a lot longer and a lot of people are living because of artificial ways, I guess. And most of the people who will die from corona are those people that have a lot of diseases to begin with. But it sounds really hard when I'm saying it, and of course I wouldn't want my grandparents to die, but I can still, some parts of me can see a little benefit from it anyways.
Is that something that comes from your studies, or you're a biologist or scientist, or what sort of?
Oh, I don't know, I'm quite logical,
Okay.
I guess.
Well, what you say about being logical is quite interesting, because I can see how a very logical person like Dr. Spock
Oh yeah,
in Star
yeah.
Trek, yeah? Would you compare yourself to Dr. Spock in Star Trek for a moment?
I've never seen it, but I've heard of it through Big Bang Theory and Sheldon Cooper. So
Very good references.
Yeah, but I'd say Sheldon Cooper is in the same kind
Ballpark.
of character somehow.
What's his name? Sheldon Cooper?
Cooper, yeah.
Is he in the Big Bang Theory?
Yeah, he's the one with the undiagnosed autism.
So what would he say about this current situation?
Oh, he would say, this is great.
Really?
I think so.
Would he be logical about it like you are?
Yes, he would. I want to know what all the fuss is about. So to speak.
Well, I think that's a very good way to end.
Yeah.
With a question.
Oh yeah, sure.
Say it again, what's the camera like?
I just want to know what all the fuss is about. I'm not made for camera.
There you are.
I could not help but think of the history professor's book, Are Swedes Human? She had, of course, raised the issue of our ability to cope with death.
Plagues happen periodically. So there was a kind of an ability to live with death, which we today have lost. I'm not saying that's bad. I mean, surely it's good that we have better healthcare and that we respect each human life, that we talk about human rights in a way which we didn't do then. But we also have become perhaps sort of sensitive to the point that we have lost sight of the relationship between epidemics and death more generally on the one hand, and other values that have to do with keeping our societies functioning, right? And I think that, for me as an historian, is interesting that we're in this moment now of an almost global hysteria, right, that has translated into such harsh measures, right, that they are hard to kind of understand if we had put everybody in a time machine and transported ourselves back 100 years or even 50 years.
Was it universally the case that the elderly wanted to be locked up? The churches had been strangely silent on the topic, or else the press had not been reporting their views. What would they have said had they been asked? Churches, for months, had not even been open for private prayer.
Very interesting point. We at my institution, we have a study right now about the civil societies respond to the COVID and Corona crisis, right? And it's interesting because both the churches and other kind of associations, right, in civil society, their lifeblood, of course, is sociability, right? It is actually meeting with each other, taking care of each other, showing empathy, caring for each other, right? All of this has now been, in a sense, sacrificed on the altar of social distancing.
I was left with the conclusion that there was this very rational side to Sweden. Was it inhuman? I could understand why our personable Prime Minister had felt the compassionate need to lock down to save the health service, even for a limited period, and to follow the growing pressure from both his own citizens and the press. He could hardly be blamed for a U-turn. But was the UK government ever really following the science? It was looking less and less likely to me. I wondered at the fault lines in the relationship between the UK government and the health authorities, and the disproportionate power of one man's exaggerated report.
You know, I myself, my father's second wife, who is now turning 87, she is dying now from lung cancer, right? And you know, we've had this discussion in the family. Okay, so what do we do with this? You know, she has a life expectancy of months at the very best, right? And so should our response be to sort of lock her up in solitude and never see her and let her die alone from lung cancer so that she will be protected from COVID? You know, now we decided not to do that. You know, we decided to try to be careful, but somebody's with her all the time, right? Because we have argued that it's better for her, more important for her to have that warmth and human comfort, right? Than to be in a sort of sanitary lonely spot, right, surrounded by plastic. So I think your question is very well taken, and it must be a very tormenting question, and not least for churches whose entire business, right, is this care of the spirit, of the human spirit.
With the health experts having to have regard to public health in general, not just short-term deaths, the whole point of the Swedish system was that it was designed to respect and follow the science. Indeed, was Sweden the only country following the science?
So really, you've got this rather bizarre and grotesque situation in which governments, like some sort of dystopian Hunger Games situation, are actually competing for a kind of the laurels in minimum number of deaths, having manufactured a controversial league table against which those results can be measured. It's you couldn't make it up, could you, when you think about it? You couldn't make it up. Is this being done consciously or unconsciously? Is it driven by politicians? Is it driven by the other suspects that I'm going to look at during the course of this vlog? Or is it just some sort of witless, blundering exercise in demonstration of humanity's idiocy?